Hello, I'm Dr. Andy Hall. I've had many requests to do a demonstration on how to apply laser for lung disease, and I'm happy to do so. I would like to start by discussing a few safety things first. Number one is that the doctor and the patient should be wearing eye protection. Another thing is we often have patients with tattoos, and you need to stay off the tattoo. You will risk burning the patient if you laser a tattoo. The other thing is that you want to stay off the trachea. We don't want to get up into the throat area because we do not want to laser the thyroid gland. You're likely to make your patient sick. So, with that in mind, I'm going to introduce my son Sean, and I will show how to do some laser technique for the lung fields. I'm going to demonstrate with a Platinum Series Sumis laser. I consider the best laser on the planet. Sumis P4 model comes with several different hand pieces. You have a 50 millimeter handpiece, a 25 millimeter handpiece. What we're going to suggest is that we use a 25 millimeter handpiece. We can narrow it down a little bit. The larger handpiece is great for thoracic spine, for lumbar spine, a lot of area that you need to cover, which we need to do for the lungs. However, we want to stay between the ribs as much as possible. You're not going to be able to completely stay between the ribs, but we're going to use a 25 millimeter handpiece, narrowed down a little bit, and what we're going to do is we're going to start at the sternum. Don't worry about getting the laser on the bone. The laser will pass through the bone, but what we want to do is get through the intercostalis muscles, work our way around the ribs. We're going to start at the sternum. You will notice I don't have the laser turned on. There is no point in my lasering my son with this. His lungs are fine. So we're going to just slowly move the laser, following those ribs. Once we get down here, we're going to actually raise the arm up and get it under the lung fields. You're going to continue to do this throughout the entire quadrant. You're going to take that laser all the way out to the side of the ribs. With our treatment protocol, we have established for interstitial lung diseases, it takes 4.5 minutes per quadrant. So that's 4.5 minutes on the left lung, 4.5 minutes on the right, 4.5 minutes on the back, on the left, and 4.5 minutes on the right. So the total treatment time is going to take about 18 minutes. So what we're going to do again is we're going to just follow between the ribs. We come down a little bit lower. You want to get as close to midline laterally in the ribs as possible. One of the things we need to discuss is treating women patients. We're going to have breasts that are going to be in the way of the areas we're going to treat. Again, the laser will pass through bone quite nicely. And same thing with the upper breast tissue. We won't have any problem passing through that tissue whatsoever. What we do with a woman is we will have them cup the breast. We're going to have them wear a bra, and they're going to laser up underneath the breast. And you're going to just stay in between the ribs. If you run into some breast tissue, again, that's not a big deal. The main thing is we want our women patients to be very comfortable. I prefer the woman to just wear a bra. And when I do the back, I would prefer to just unhook the bra and get the bra out of the way. But again, we want the woman patient to be very comfortable while we're treating her. We want to respect them at all times and just keep them comfortable. So let's turn around and we're going to demonstrate the back. Again, we're going to start up on the upper part of the lung fields, and we're going to slowly move the laser slow enough that there's no burning. I should say fast enough that there's no burning. What the patient should feel is a nice healing warmth. Again, now we're going to get over the scapulae, and again, that is no problem whatsoever. We're recommending a minimum of 10 watts, and with that wattage, the photons will pass through the scapula. And then again, we're going to come down, and now we're going to go up underneath the arm, and we're going to continue. And again, this quadrant will take 4.5 minutes. So we finish with this quadrant. The patient can drop their arm, and then we're going to go on to the other side. So very simple to do, and that pretty much concludes treating the lung fields with a lung patient. Thanks for watching.